Might just give you guys a notification there, just so I can have it for afterwards, okay? Okay, so yeah, thank you guys all for coming and listening to me chat on a Saturday at 3 o'clock. So whether you're a brand new mom, a mom to be, or someone that's just interested in postpartum recovery, we've made the choice to be here today to kind of come chat about this. And so thank you for that. And so welcome, postpartum recovery, restoring core and pelvic health, okay? So for those of you that don't know me, my name's Dr. Dalen. I'm a chiropractor here at Strive Health and Performance in Burnaby. And I have a focus on, women's health, specifically prenatal, postpartum. I work with, women of all stages, motherhood, helping them feel strong, supported, pain-free. Because let's be real, carrying a baby, whether inside or outside of you, is a lot of work. So, a little bit about me. I was born and raised on the north end of Vancouver Island. I spent a lot of my childhood competitively dancing, which was kind of what first introduced me to, the health girl world. I spent a lot of time at physio, a lot of time at massage back then, all those muscle injuries. I then kind of graduated high school, moved down to Victoria, where I got my Bachelor of Science in Kinesiology from the University of Victoria. And that was kind of where I fell in love with chiropractic care myself. I had an injury, I had, experienced it all hands-on, and I was hooked. I knew I needed to do that. So once I graduated, I moved to Toronto to do chiropractic care, and I went to the Canadian Memorial Chiropractic College. And then since graduating, I kind of did more courses into that perinatal and postpartum care through a couple of associations. One of them's ICPA and the other one's a CCA. So both of them are basically just based out of Canadian stuff and the American stuff. Some other fun facts just about me in my spare time. I mean, you'll often find me kind of traveling, exploring to new places, throwing punches, but in a fun way, I promise, as an instructor at Rumble Boxing. And when the sun's out shining, I'm hiking, I'm paddleboarding, camping with my husband, that kind of thing. So, kind of an overview. Let's be real, postpartum life isn't all glowy Instagram photos and that magical bonding moment between sleepless nights, navigating all the new demands in your body, and wondering, will I ever feel like myself again? The struggle can definitely be real. So that's kind of why we're here today. This workshop is all about equipping you with the tools, some exercises, and some insights on how to support you and your body during your journey. It's all about feeling connected to, your core, not just physically, but also emotionally, because your core is not just your muscles, right? It's kind of that foundation of your strength, your stability, and honestly, your confidence. So I just want to take a moment to acknowledge everybody kind of in this, we'll say this hypothetical room, is unique, right? Your journey to motherhood, your postpartum recovery, your birth, everything is kind of your own. There's no one size fits all way to do everything. So this workshop isn't about, unrealistic expectations or those quick fixes. It's about restoring function, rebuilding strength, and kind of learning to like honor where you are along the way. Because again, that's going to look different for everybody. So we'll kind of talk about, the impacts that childbearing and childbirth kind of has on your body. Obviously, some options how to alleviate that. And then we're going to go through all the exercises kind of together. That's kind of the overview. And then at the end, we'll talk a little bit about some tips and tricks, some self-care stuff as well. And like I said, kind of open for questions. So that is the overview. So we'll kind of start off with obviously postpartum, spinal, pelvic imbalances, everything that's kind of happening to your body. So I'm sure many of you might have, felt or had like during your postpartum, during your pregnancy, feeling like things were just off, like your posture, your balance, the way you walked, maybe during your pregnancy, and then now after, once you've given birth, maybe you noticed more lower back pain, more hip discomfort, or even like that mom hunch, we like to call it. Basically all these things trying to kind of creep in. If this is something that sounds familiar to it's not that you're alone. Like these are all very common things that kind of happen. Obviously, during pregnancy, your body's going through a massive change. You obviously are growing something, but your body is growing and changing as you go, and you're kind of having to accommodate all of that at the same time. Obviously, 9 months sounds like a long time, but that's also not a very long time for your body to be having all these changes. So lots can happen. After delivery, your body's not just going to snap back. Your body's kind of in that that state of healing and readjustment. So understanding where and why these imbalances can come from and what's happening can be crucial to your recovery. So let's first talk about, what happens with your posture. So your baby's growing, your belly is growing, your center of gravity is kind of having to like shift forward, right? You're piling on this weight, it's creating more pressure into your toes, putting a bit more strain onto that lower back. And to compensate, your body kind of has to naturally adjust, right? So it increases that curve of your lower back and kind of gives us what we call a lordosis. So this is kind of why many pregnant women are going to experience low back pain. It's not just the weight of the body and the baby, it's kind of that shift of your posture that's adding pressure onto your spine and all of those muscles and joints around it. At the same time, your shoulders might, start to round forward. And again, there's added weight due to your growing breasts. And again, that natural forward pull of your body with the growing baby. And this can kind of lead to what we call like the mom hunch, or again, just like a rounded upper back. You get tight chest muscles. Everything's just kind of pulling you forward. Kind of think of it like that text neck, right? Everyone's looking down. And it just makes it harder for you to maintain a good posture postpartum because this has already been happening throughout the entire pregnancy. And then the pelvis. So the pelvis is your body's foundation, right? It's also your base of support just normally, but during pregnancy, this is kind of where everything's going on, and it undergoes just like such big changes for you to prepare for childbirth. You have the hormone relaxin, which is going to loosen all of your ligaments, obviously in the whole body, but also specifically in your pelvis. So this can allow for expansion, allow for the baby to come out. And while that is necessary for birth, it can also cause you a lot of like instability, making you more prone to that pelvic pain. All these things just being a little bit off. Okay. One of the most common postpartum pelvic imbalances too is what you're going to see is kind of like that anterior pelvic tilt. So again, we're having this like exaggerated lower back curve, but your pelvis is also going to kind of tip forward, which gives us even more of an exaggerated lower back. And this can lead to low back pain, weak core muscles, that kind of thing. Another common issue is just pelvic asymmetry. So you're going to basically see like one side of the pelvis becomes more dominant than the other. And this kind of can happen due to many things. One being like you're carrying your baby on one side of your body versus the other, and you kind of like rest it on your hip versus the other. If you're favoring one side for breastfeeding versus the other, or even just how your body has compensated for the baby's position when it was in the womb, right? Like if they were leaning towards more to one side, if their head was on one side versus the other, that's going to change how your body was holding things. And again, this can kind of contribute again to hip and lower back pain, and then even just postural stuff, issues with walking, moving. So that's kind of like impact on spine. A lot of this you'll see again, like lower back pain, pelvic pain, hip pain, all of that. And even some of this can kind of lead to those weak pelvic floor muscles and can lead to like things like incontinence or pelvic organ prolapse, that kind of thing as well. And then it's kind of the muscle side of it. So again, your body is changing. Your body has been growing. So your abdominal muscles obviously have to stretch, and they have to basically change a lot to allow for this to happen. So one of the biggest muscle changes that women will notice is kind of this separation, or what we call a diastasis recti, of those abdominal muscles. And this basically is like the core is weakened in such a way that it struggles to support the spine and the pelvis. And then you kind of get, again, back pain, poor posture. All these things are kind of all related, okay? So think of your core kind of like a canister. It's not just about the abs, but it's also a system, right? You have your diaphragm, which is your lungs. You have your deep pelvic floor muscles. You have your abdominal muscles, and you have your low back. And if one part of this isn't working optimally, then the whole system's basically going to be affected, okay? So that's why I like, when we talk about changes in your muscles, we talk about change your back, like postpartum recovery isn't just about, doing some crunches, doing some planks, doing some sit-ups, and then you're back to normal again. It's kind of the whole system and how everything works together. Okay. So that's kind of just an overview, a lot of obviously big words at you guys, but the biggest things that is going to happen, you're going to get kind of core weakness, and you're going to get changes into your joints, into your muscles of that lower back. So next we're going to kind of talk about some of these things that kind of come up out of all of this. And this one is one that's not talked about like a ton, but pelvic organ prolapse. Um, we obviously just talked about how our body all is shifting, compensating. So here's something that can come about of it, okay? This is kind of a topic, like I said, that doesn't get talked about enough, but it's very important. Um, Often very common after giving birth, definitely a vaginal birth rather than a C-section. But again, something we should talk about. Okay, so what is it? Pelvic organ prolapse is basically when the muscles, the tissues of your pelvic floor have been weakened so much that one or more of your organs can basically drop or press down onto your like vaginal wall. Okay, so if we think of your pelvic floor like a hammock, you guys can all see me here. Basically, a hammock that supports your organs. If this hammock gets too stretched out this way, it starts to like sag down, or if it gets too weak, again, it's going to sag down. And if that's what's holding your organs and that starts to get weakened and sags, then eventually these things are just not going to be where they're supposed to be. Now, there's three different kinds of types of prolapse that we mostly see. So the first one is bladder, and basically that's just, again, the bladder is dropping down and pushing down into your vaginal wall due to that weak support. There's the uterine, which is where just the uterus is descending downwards. And then there's the rectal, which, again, the rectum is like bulging forward. Now, this sounds all like scary, and everyone's probably like, what the heck? It's not something to panic about. But if it's something that happens, which again, it can be very common, it's definitely something you want to catch and kind of manage early. So here's some kind of key signs, things to look out for. The biggest thing people kind of talk about is like a heavy or dragging sensation into your pelvis. It could feel like something's, falling out or bulging. Some people say it feels like they have a tampon in that's falling out. If there was like a visible or tangential bulge, again, if you were like wiping or showering, something like that, and you notice that, that would be kind of something to look out for. If you're having difficulty with bladder control, so if you feel like there's a lot of urgency, you feel like you can't fully empty your bladder, or you're just like leaking a lot, then again, this might be something to consider. And then if you're having pressure or pain, or even just like discomfort when you're exercising or standing too long. So oftentimes because of gravity when you're standing, or even, at the end of your day, just all that gravity kind of pulling down and doing it can kind of make things feel worse. And then trouble with like bowel movements, again, something like straining or constipation or feeling something in the way might again affect this. Okay. And like I said, like who's kind of at risk for this? So usually there's kind of certain factors. Obviously, like a vaginal birth is like the first one because again, it stretches all those tissues out during labor, which weakens your pelvic floor muscles. If you've had more pregnancies, so the more there are, the more strain there's going to have on that pelvic floor. If you're someone that's been doing a lot of heavy lifting, a lot of strength training, things like that, that can again put a lot of pressure onto the pelvic floor over time. Another thing is if you're kind of getting back into high impact exercise a bit too soon, so things like running, jumping, again, heavy lifting, too early can kind of cause that cause that prolapse in postpartum. Now, again, obviously that sounds all scary, but there's lots of things we can do about it. So if any of these signs sound familiar, obviously don't ignore them. There are plenty of ways to help manage and improve it. The first thing is obviously like a pelvic floor physiotherapist. A lot of women have been seeing one during their pregnancy. If you haven't, that's totally normal, totally fine too. But they might just be able to help you assess it, guide you through some specific exercises, strengthening, relaxation, that kind of thing. Obviously some core, some pelvic floor exercises. Again, things like strengthening the deep floor, your diaphragm, and your pelvic floor can help support the organs again. Lifestyle adjustments, so avoiding, that chronic straining, high impact activities, just especially in the first little bit when you're kind of recovering. Focus more on the exercises, the breathing first, instead of trying to get back to like running a marathon like you might have been used to. And then lastly, in some cases, they do have like some supportive devices. So there's what's called a pessary. So a small kind of device can be inserted inside and just kind of give you more support during the meantime as well. Okay. So now that we kind of covered pelvic prolapse and how that can impact your recovery, we'll talk about another kind of common postpartum concern, which is again diastasis recti. Okay, so the prolapse was all about support of the pelvic organs and how that gets kind of weakened during childbirth, and then this one's all about the integrity of your core muscles. So what is diastasis recti? It's a condition where basically the rectus abdominis, which is your six-pack muscles, they separate along the midline. Okay, so basically they're getting stretched, getting pulled, and that there's a line, or sorry, connective tissue down the middle of your stomach, and sometimes when you're pregnant, you get that line, and that's called your linea alba. So that kind of gets pulled on and stretched apart, which creates this separation. During pregnancy, as like the uterus expands, like I said, accommodate this, it gets stretched to its limits. That separation creates a visible gap or sometimes even a bulge right in the middle of the stomach. And you'll notice it a lot when you do things like sitting up, or if you're like lifting something heavy, it'll kind of bulge out a little bit. So what kind of contributes to it? So obviously the growing belly, the expanding of your uterus kind of places a lot of pressure onto your abdominal muscles and stretching them as they try to accommodate for the baby. This again causes the two sides to kind of pull apart, leading to that separation. Hormonal changes is another cause. So the pregnancy hormones like relaxin, which we kind of said I talked about before, that loosens everything up. But also progesterone, which kind of causes everything to loosen too, just makes everything more susceptible to all this loosening and all this stretching. If you have weakened core muscles, just to start with, maybe pre-pregnancy or during your pregnancy, this can, again, just because they're weaker, it just creates more weakness, and the core loses its ability to just stabilize the spine and the pelvis effectively. And then, like I said before, kind of those movements that cause intra-abdominal pressure, so heavy lifting, or if you're just like always slouching forward, or like improper techniques of like different exercises. So if you're like squatting or lunging, and again, it's just putting a lot of pressure onto it. Now, obviously, that's all good to know, like what it is and what it causes. But I mean, most of you are probably like, okay, but like now how do I check for this, right? So obviously, best case scenario would be to have it evaluated by a professional if you felt like there was some separating, whether that be a chiro, a physio, an OBGYN, like midwife, whoever it is. But you can kind of gently, palpate it, see if it's happening to you very firstly. So what you could do is basically lay flat onto your back and kind of like bend your knees, and then basically putting your hand like two finger widths basically just above your belly button, right in the middle of like midline of your stomach. And then when you're laying flat on the floor, just lift your head slightly off, like almost like you're doing a little mini crunch, and kind of feel for it. And if you feel like there's a gap between there, then again, it would be a good thing to get it kind of checked out. If there's no gap, then you're all good there. It's pretty normal to have a little bit of one. So if you have one finger width between it, like that's very normal. If you're having more, like you could put 2, 3 fingers, then that's probably something where you'd want to get it checked out a little bit more. And again, this is all great, but like, how do we treat it if I do have it? Because again, it sounds scary, but it's very normal, very common. It's obviously important to address it though in the beginning, because you do want to restore your core strength and kind of get back to where you were before. You don't want to just leave it hanging. So the first thing you can obviously do is some postpartum core exercises. So things that are focusing on core rehabilitation. And we'll kind of go through a lot of them, but things like pelvic tilt, modified plank, abdominal breathing, that kind of thing, okay? Obviously, avoiding strain, so avoiding movements that are going to increase that intra-abdominal pressure, things like crunches, sit-ups, heavy lifting. Just stay away from it in the beginning until it's all kind of healed up. Obviously, like doing physiotherapy, so or even a chiropractor trained in postpartum recovery, they can kind of help you get a personalized exercise plan, safely strengthen that core back up. And again, they can assess it and tell you kind of if it is bad or if it's not bad, that kind of thing. Okay. Chiropractic care, obviously, it can help address any of the like alignment issues, spine, pelvis, that kind of thing. So again, like we talked about before, muscle changes, spine changes. So everything kind of is affecting. It's not just like a one area, it's everything all together. It's a whole system. So working on relaxing your low back, loosening up those muscles, getting your pelvic to move properly again will also help with this. And then kind of another thing you could do is also, if it was quite bad or if you needed kind of more help, was wearing a postpartum support belt. So this can help, again, further the separation as you heal and just kind of compress everything together. All right. Now, if you weren't to get this treated or if you kind of left it, there are, a variety of things that kind of can happen. Obviously, over time, it would just lead to more core weakness. That's kind of the biggest thing. The abdominal muscles are obviously essential for stabilizing your spine, stabilizing your pelvis. And when it's separated like that, it just kind of compromises that core's ability to support you in your day-to-day stuff, and just in any movements, honestly, in a day-to-day. This obviously can lead to, pain later on, or weakness in the pelvic floor, difficulty performing exercises, movements, that are all kind of related to that pelvic floor and abdominal wall. Another kind of thing that can happen is obviously lower back pain, because again, with those weakened core muscles, your lower back kind of has to compensate for this. Again, think of it as a whole system. If you're not able to use your core and engage your core, you're going to lean on that lower back, and that's going to strain that lower back over time, and just kind of cause a lot of issues for your muscles and your joints. It can also lead to pelvic floor dysfunction. Again, weakened core muscles, everything's really closely related with that pelvic floor. So it can lead to things like urinary incontinence, which is basically like leakage when you're sneezing, coughing, exercising. It can lead to pelvic organ prolapse, because again, the pelvic floor is weakened, or just pain and discomfort into the pelvic region in general. And then kind of lastly, obviously, worst case scenario, but in some cases, if the abdominal wall is weakened, it could also lead to like an umbilical hernia. And that's just where like part of that intestine kind of protruding through your abdominal muscles near your belly button, which is a very rare case, but again, something that could happen. Okay. So those are kind of all the muscle things. And then, again, the bigger one is kind of postpartum low back pain. So this is probably a topic that most new moms know all too well about, and that is lower back pain. So whether it's from hours of rocking your baby, hauling car seats around, or honestly just the aftermath of pregnancy and labor itself, back pain unfortunately seems to come as a package deal with motherhood. But here's the good news. You don't have to just put up with it, right? It's very treatable, and as a chiropractor, like I can help you understand like why it happens, and again, more importantly, how to manage and relieve it. So a lot of symptoms of lower back pain you're gonna kind of notice: dull, aching pain into your lower back, stiffness, especially in the morning or after prolonged periods of like sitting, standing. Especially as a new mom, you do a lot of this, laying down, a lot of sitting, breastfeeding, where a lot of us are sitting in like those rocking chairs, you're sitting on the couch, like you're sitting in bed, all these things. So that can lead to a lot of stiffness, pain that's worsening when you're like lifting, bending, carrying the baby. Again, that lifting them out of their bed, just lifting them up off the couch, like lifting it from someone else. These are all like symptoms that can happen. And then just difficulty, obviously, performing your daily activities, again, due to this discomfort. So obviously that's all great, but how do we help you with that? Chiropractic care can basically help you, again, like relieve all of this dysfunction, all of the instability that kind of comes through that. So taking care of those muscles, those joints, getting more movement back into them, relieving all that tension, that stiffness. That's basically it. Just trying to get your body properly moving again. The postpartum exercises, strengthening, all that stuff will help with relieving the back pain. Again, like I said before, it's a whole system, so we can't just rely on that low back. We need to build up our core strength again, so it takes some of the brunt of that. Obviously, doing some stretching, some mobility work, some gentle stuff for low back, for the hips, for the pelvis can kind of alleviate the stiffness, promote flexibility. Now, I do like to quickly pause and say, like, sometimes when I tell people, oh, we need to do some stretching, we need some exercises, and they are postpartum, they panic because they're like, I don't have any time to do these things. Now, it doesn't need to be like an hour of your day. It doesn't need to be this like extended thing. Honestly, like 3-5 minutes, quickly doing some of these things can go such a long way and make such a big difference. Especially in the beginning when there's so much going on, like postpartum. Okay, and then some other things, obviously, like ergonomic support. So using proper posture when you're breastfeeding, when you're lifting, when you're carrying, avoiding twisting when you're doing these things, and just not like excessively bending, excessively twisting, that kind of stuff. And then lastly, if it's really bad, obviously, you can also do some heat or some ice to those areas, like 15-20 minutes on, 15-20 minutes off, wherever it's kind of sore. Okay. So that's kind of a brief, overview. We talked about, what's going on, all these changes, some of these kind of bigger change topics. And now let's kind of focus on like how do we address it with some of these exercises? So one of the best ways to support obviously your lower back and your abdominal muscles, your core muscles, your pelvic floor muscles is to rebuild this core strength safely, okay? But like I said before, we don't want to jump into these crunches, these sit-ups, these high intensity ab workouts, because that can do a bit more harm than good. So instead, we're going to focus on more gentle, intentional movements that are engage your deep core muscles, support your spine, and kind of work in harmony with the pelvic floor. Now, I'm going to kind of go through each exercise individually. So if you want to do them, feel free to do them alongside them as I'm talking about them. I can also send you all these exercises at the end, so don't feel like you need to like rush and write everything down. But yeah, we're basically going to go through each of them a little bit more in depth. I watched a little video of me doing them, so I'm going to kind of talk through them. You should have time to do them alongside. If not, again, I'm going to send them to you after. Okay. Okay, so the first one is a pelvic tilt, okay? Very like great way to start, just very gentle on the body, very basic on the body, just for basically getting your core back, like thinking about basically like engaging it and thinking about what it needs to do again, okay? So basically the position this, as you can see me in the picture here, is you're gonna be on your back, your knees are gonna be bent, your feet flat on the floor, about hip width apart, and then you can kind of just rest your hands side to side. Now, when you're laying flat, you kind of want to check in with yourself and like see what you're feeling, see where you're feeling. Is your lower back kind of like naturally arched off the floor? Do you have a really high arch? Do you feel like you're like pushing yourself into the mat? What I want you to think about is just like being there, whatever feels kind of natural for you. Don't kind of force anything right now. You're just going to relax, okay? Now, to gently kind of work things and get these deep core muscles moving, we're going to take a slow, deep breath in through your nose. And you're thinking about letting your belly expand, letting those ribs expand. And then as you exhale, you're going to think about pulling your belly button towards your spine and tilting your pelvis backwards so that your lower back kind of gently presses into the floor. Now, we're not looking for a booty lift. You're not tucking that. It's just very subtle, okay? And then you'll hold that for a second and then inhale and kind of return back to that starting position with whatever your natural curve is going to be. I'm going to kind of like replay this again so you can kind of see it. I go back like this. So it's very subtle. You can kind of watch me tilt my hips forward there, holding it for a second, and then returning back, okay? And the idea is for this one, you're trying to aim for like just 10 really slow, controlled reps. You can close your eyes, you can think about nothing, think what you know, just really focusing on tilting that core and the pelvis back and forth, okay? This is like honestly one of the safest ways to rebuild your core postpartum. I know it seems like it's not doing a lot, but I promise you it's doing a lot. Okay, so that's number one, pelvic tilt. The second one, a heel slide. So again, you're gonna kind of be on your back, your knees flat, feet against the floor, hip width apart. Your hands can be on your lower belly or like I'm doing here in the picture, just by your sides. And you're again keeping that spine neutral, not forcing your lower back into the mat, but not really letting it have like be super arched either. Again, you just kind of want a neutral middle ground. Okay. So the move, you're gonna again take a deep breath in through your nose. And as you exhale, you're gonna kind of engage that core, thinking about pulling your belly button in towards your spine. As you do that, you're going to slowly slide one of those heels away from you, extending your leg along the floor. Again, all about slow, all about controlled movement. And then once that leg is fully extended out, you'll take a deep breath in and exhale and slide that back to your like the starting position again. I'm going to play the video one more time and we can kind of watch me do it. So all the way out, and then again, breathing in and pulling it back in. Okay, and then you're gonna repeat this, do like 10 per side, obviously alternating each leg each time. And again, very slow, very controlled, okay? So some things you'll notice, you wanna check in with yourself because we wanna work smart, not hard, okay? You wanna make sure that your lower back isn't lifting off that mat. Again, all about your core, okay? So if you feel like it's like really arching, then you wanna just like stop, reset, be like, okay, focus on my core again, and then bring that heel out again, okay? If you notice that your shoulders are kind of shrugging up to your ears, again, just take a moment, relax everything down and be like, try to focus just on the core. Sometimes it's a lot easier said than done, right? Our whole body wants to help us rather than just that core. And then last thing is just like, again, making sure it's not going to be too quick. Slow control, not about speed. It's not a sprint here. It's all about the marathon of slowly doing it. Okay. So that's the heel slide. Now, next one is a glute bridge. There's a theme here. Everything starts on his back, it seems like. So lying on your back, your knees are gonna be bent, feet flat on the floor, about hip width apart. Your arms kind of rested by your sides, palms facing down. Again, we want that spine to be neutral, no arching or pressing your lower back into the floor, okay? Just really neutral throughout there. So before we move again, kind of checking in with your breath always. Your breath is going to be such a strong tool for you. So if at any point when you're doing these things, you feel like you're not holding your breath, like just come back to it, laying flat there, just be like inhale and exhale and just really focusing on it. When you inhale, really trying to focus on expanding those ribs, expanding that belly. And when you exhale, just gently kind of engaging that core, okay? You also kind of, for this glute bridge, want to engage a little bit of your pelvic floor. So when you exhale, you kind of want to think about you're stopping kind of that flow of urine. Obviously, like we wouldn't want to do that, but that's the kind of motion or that feeling that you're looking for, okay? So again, the move is you're going to inhale, and then when you exhale, you're going to press through those heels, lifting your hips up towards the ceiling. No need to go sky high. We just want that controlled, slow motion, keeping that lower back happy, just trying to lift that butt off the ground. When you get to the top, you're going to squeeze the glutes. I always say you're squeezing it like you're holding a winning lottery ticket, okay? You don't want that lottery ticket to fall. And then as you inhale, you're slowly going to lower your hips back to that starting position. And I'm just gonna, again, play that video one more time here for you so you can kind of see me do it. So up, squeezing those glutes at the top, and then inhaling, slowly lowering it back down. Okay? Then you're gonna repeat this about 10, 12 times. And then, yeah, things to look out for too. Again, all about like making sure that that core is engaged so we're not straining that lower back, we're not putting excess pressure onto it. So make sure you have a neutral spine when you do it. You don't want to push up too high. Like I said, we're not trying to break records, just trying to lift it up and down. Another big common thing is using your lower back instead of your glutes. So think about booty power, not back strain. When you're lifting it up, think about like when you first start to lift your butt off the ground, you're already kind of engaging those glutes. You're already kind of squeezing them, so they help lift you up rather than using your lower back muscles to lift you up. And again, like I said, breathe through it. Oxygen is your best workout buddy, your most powerful tool. So make sure you're breathing in and you're breathing out as you do it. Okay. And then because we've been talking about breathing so much, let's talk about the abdominal breathing exercise as well. So again, lying down is the most easiest way to do this one, but you could also do it sitting or standing, whatever kind of feels good for you. If we're doing it on our back, we're gonna lie flat. Your knees are gonna be bent, those feet flat on the floor, and you're gonna put one hand on the belly, one hand on your chest, as you can kind of see I'm doing here. When you're lying here, you want to really relax your body, kind of scan through it, see if you feel any tension in your back, in those shoulders, in their neck, whatever it is, and just try to like let yourself relax, shift until you feel good and supported into it. Now, before you kind of get started, you want to just kind of take a normal breath in and out and notice where you feel movement, okay? Is it in your chest? Is it in your belly? Is it in your sides? Like, where do you feel it? And it's not about judgment, it's just about like awareness, like where is it naturally going for you? And then we're gonna kind of, when we're breathing, we want to focus more on the ribs and more on the belly, okay? So when you take a deep inhale through your nose, you're gonna imagine you're sending your breath down into your belly and allowing it to expand gently like a balloon, okay? So think about there's a balloon on your stomach and you're blowing that up. And at the same time, you also want to think about your rib cage ballooning out too. So it's not just your belly, it's also about that rib cage. So yeah, you should feel your ribs kind of widen side to side as you inhale, and your belly should rise again slightly, but the chest should be relaxed. Nothing's kind of coming through the chest, nothing's coming through the shoulders, okay? Then as you slowly exhale, you're going to go through the mouth like you're blowing out a birthday candles. Again, long, controlled, nice and gentle. As you exhale too, you want to gently kind of engage your deep core. So think of drawing your belly button slightly towards that spine. We're not sucking in too hard, but just kind of pulling it in a little bit, okay? And then 5 slow breaths. That's all the move is, okay? Inhale, belly expands, ribs expand. Exhale, core gently engages. And I will replay this one more time there. It's a subtle movement, but you can kind of see through my hands when I kind of breathe into my stomach and then down. The one thing I didn't do in this video was obviously breathe through my mouth, but that would have been an easier way to do it. Okay, things to look out for, again, not breathing into that belly and ribs, like that's what you want. So you want to make sure that it's into the belly and the ribs, not into your chest, not into those shoulders. If they are rising, if it's lifting, you need to just stop, take a moment, and really try to focus onto the belly, onto the ribs. Obviously holding your breath, we don't want that. You want to keep it flowing. The goal is to just have that controlled, slow breath with movements, not trying to work against everything. Obviously, if you have a lot of tension like in your upper body or your neck, just again, really try to relax your upper body. And then the last thing is over engaging those abs or sucking in. So you want to, like I said, gently kind of pull that belly button in, but we don't want to be like bracing for impact by any means, okay? And so that is that one. Okay, so now we're gonna talk about plank. This is another really good one. Again, the only exercise that I picked that's not on your back. But we're not gonna do a full plank. Everything's just gonna start with a modified one first, okay? We don't need to overload the core. It needs to just be gentle onto that body. So I wouldn't say I did a great job in this video, but as you can kind of see, you can start by positioning yourself onto your hands and knees into that tabletop position, okay? You want those wrists stacked under your shoulders, knees under your hips, and you're gonna, again, think about that spine being neutral, not sagging your belly, not angry, rounding it like an angry cat. It's very flat, very neutral. You're going to engage that deep core by, again, gently drawing that belly button into your spine. And if you've been pregnant, a lot of times people will tell you like that hugging that baby move, that's what you're thinking about, like hugging your core in, okay? Rather than the sucking in, just about the hug. Okay, so then you're gonna like walk your hands slightly forward and shift those weight forward so your shoulders are kind of over your wrists. Now, you're gonna step back your feet back onto you're resting onto your knees, and then you can either go onto your hands or onto your forearms. That's why I kind of showed both in this video. Whatever's gonna feel good for you, right? Some people it's gonna feel better onto those forearms. Some people it's gonna feel better onto your hands. Whatever feels good. There's no like right or wrong way with this, okay? When you kind of roll forward, you're going to tuck your pelvis slightly. Think about like you're zipping up your favorite pair of high-waisted jeans. This is going to keep your lower back protected, keep that core engaged. Your neck wants to be long. We're not turtlenecking, and you're looking down at the mat, okay? And then all you're doing is just going to hold this position, breathe, inhale through your ribs, exhale, and gently activate the core, and hold it for 10 to 15 seconds to start. We can always gradually build up, then do 20 seconds, then do 30 seconds, that kind of thing. But just to start, 10 to 15. Okay, let me just replay that one for you. Okay, so again, you can kind of see me lean forward, get into position through there, kind of on those hands, and then dropping down through here. Now, some common mistakes, which you can kind of see me do it honestly here, is that kind of sagging of the belly, okay? So you basically, the core is not engaged. It wasn't engaged as much as in my video here. You can see it, and I'm kind of like rounding through my lower back there. That's something that you want to avoid. Obviously, holding your breath. Again, we're breathing in, we're breathing out the entire time. Tension into your shoulders. You again just want to relax your upper body. Don't let those shoulders creep up. Really, it's about the core, right? Really focusing on that the whole time. And then, yeah, also if you might notice like, again here, like my back isn't flat, but I'm also doing a little bit of a booty pop, it kind of looks like, again. So you want to keep that a bit more neutral. That's the biggest thing. Okay. And then the last exercise here is a Kegel with a pelvic tilt, okay? So we're kind of combining that first exercise we did with a Kegel. Again, lying on your back on the mat, your knees are going to be bent, your feet are going to be flat on the floor, hip width apart, resting those hands on your sides, relaxing your shoulders, keeping your spine into that neutral position. Again, not pushing into the mat, but not overarching the back. all about the breath here. Okay. So the first half is I'll explain is the Kegel, which maybe again, some of you were taught during pregnancy. It's kind of a common one that people talk about during pregnancy now. So that's what you're going to kind of focus on. It's a small, small movement, but it's a helpful movement. Okay. So when you're laying flat like this, you kind of want to imagine that your pelvic floor muscles are like an elevator. Okay. When you contract, the elevator is going to lift up. And when you relax, it gently lowers back down. Another way to think about it again is like I kind of said before, is imagining you're stopping a flow of urine. Definitely don't practice that, but it's just about that feeling, okay? Like you feel like it's pulling it up a little bit, so it stops it, and then you relax it and let it go again. So when you're laying like this, when you inhale, you're going to just breathe normally, and then as you exhale, you're going to gently squeeze up and in. Like I said, pulling that elevator up and in. You're going to hold that for like 3 to 5 seconds. And as you hold it, we're not clenching our glutes, we're not clenching our thighs. It's all about those pelvic floor muscles lifting, okay? So very subtle inside. Then as you inhale, you fully relax and let that go. If you've never done it before, it's definitely a little awkward, a little hard at the beginning. It's just a different movement than what you're used to. So really using that analogy of the elevator, I feel like allows you to like connect with your body a little bit and like pull up and pull down. So that's the best way to think about it. And then you're going to do it about 5 slow times, okay? Pulling up, holding, and relaxing, okay? Once you've got that and you feel like you're comfortable and you've nailed it, then you can add in that pelvic tilt. So the same thing as before, you're basically, when you inhale, you're relaxing the pelvic floor, you're relaxing your belly. And once you exhale, you're going to do a gentle Kegel, pulling up at the same time that your pelvis is going to slightly rock forward, okay? So as you're pulling up, basically that lower back is flattening onto the mat. I think if I show it to you again, you can kind of see again the subtle tilt of my pelvis as I pull up and tilt. Okay, very gentle, like I said. And then as you relax, you're going to let go of that and let the body kind of relax back, the back go flat again, okay? So inhale, tilting, lowering that back to the ground, and then inhale and fully relaxing, letting it all go again. And the same thing you're going to do about 5 reps of these, okay? And the big things with this, again, is just making sure you're not holding your breath, going nice and slow and controlled. Everything is all about the breath, all about the core. If it feels like you're, again, clenching your glutes, your thighs, like something else, your shoulders, anything like that, just, again, stopping, coming back to that core, being very intentional with it. Okay, so those are kind of all the core exercises. Now, I will say none of these need to be all done at once. They don't need to be done in this order. They could be done in a completely different order, whatever felt right to you. You could do 1 or 2, a couple at a time, that kind of thing. One of the biggest things, obviously, I hear is as a new mom, time is money. And I'm not expecting you to spend hours of your day every single day doing these, right? But being mindful, taking some time for yourself, whether that's 5 minutes a day, will just help you with building back up your strength and helping alleviate, again, a lot of these like demands on your body. You could do 1 or 2 in the morning kind of thing quickly and then do some a couple days later, okay? It's not that it needs to be every single day because recovery is, like I said before, a marathon, not a sprint. So just taking the time to just, again, be intentional with movements, being intentional with these will go a long way, okay? So the next 3 slides are just some stretches, again, kind of helping mediate some of that lower back pain, some of these stiffness, this tightness, again, that happens. You can, again, do these with the exercises. You can do them on their own. Again, they're just tools in your toolbox to help you with kind of getting back that, the core strength, pelvic strength, all these different things, okay? So these are kind of my 3 favorite ones I give out to postpartum women. The first one is cat cow, which I'm sure many of you have kind of seen before, a very classic yoga pose. So as you can see I do in the video, you're gonna basically come down onto your hands and knees into that tabletop position. Hands kind of directly under your shoulders, your knees and your hips, that kind of thing. Keeping your spine, again, that neutral position. I feel like a broken record saying that a billion times, but that is like, again, that's your foundation of it all, okay? So the cat half of it, or the round up, you're gonna exhale and tuck that chin towards your chest, rounding your spine towards the ceiling. Think about pulling your belly button in. You can imagine that you're a scared cat on Halloween, okay? Pulling it all the way up. And as you do so, you can basically engage that pelvic floor as you lift, feeling some deep core activation if you want, okay? Then the opposite is the cow or the drop it low pose. As you inhale, you'll slowly drop your belly down towards the wall, lifting your tailbone up, looking up all the way up to the sky. You want to open up through that chest, but don't overarch, right? Keep it gentle, feel what good's for you, okay? I'll just kind of quickly play that again. So again, you watch me arch all the way up. Good, kind of engaging that pelvic floor, and then back in the opposite direction. Good. Now you can time this with your breath again. So when you're inhaling, you're going down into that cow and exhaling into the cat. And again, moving slowly with control, all about the breath, okay? And then I usually tell people you can repeat this about 8 to 10 times. If it feels good to do more, do that. Whenever you're doing some stretching, some mobility, that kind of stuff, you never want it to be more than like a 3 out of 10 on your pain scale. Like, so if you're really pushing it and it's feeling like it's hurting, then that's not great. But if it's feeling like it's stretching and moving something, that's okay. But that 3 out of 10 is kind of a good benchmark for most people. Okay, and then the second one is child's pose. So again, another good yoga pose you might have seen before. Basically, you're gonna, get down on your hands and knees, dropping those arms in front of you, bringing your toes together. You're gonna slightly widen those knees, again, kind of giving you some space. You can bring your knees closer together. You can bring them farther out. Again, whatever's gonna kind of be comfortable for your hips. So as you kind of lower into the pose, you're sitting back, those hips are back under your heels, you're extending your arms out in front of you. Those palms are kind of resting on the floor, letting your forehead gently rest on the mat. And then here, you're just honestly just going to breathe and relax into it. So taking a deep inhale in, expanding those ribs out back, and then exhale, let go of any tension into your lower backs, into your shoulders, just really relaxing. And you can stay here for like 30, 60 seconds, whatever. And just like I said, really focusing on the breath, okay? And then the last one is called the figure four, or when you're pregnant, a lot of people call it the baby in the basket. So this one you can do seated or you can do laying down. For today's video, I did it lying down. So kind of lying down on your back, your knees bent, feet flat on the floor. You're gonna cross one of your feet over your ankle. So for the video here, I crossed my right foot and put it over my left knee, sorry. And kind of creating a figure four or four with that, with those knees and legs. If it's here and that feels good, like you don't have to pull it, but if it doesn't feel like it's enough of a stretch, you want to lift your left foot off the ground and gently pull that left thigh towards your chest. So if I kind of redo it again, you kind of see me do that here. So if this is fine, leave it. If you want a deeper stretch, lift it up and pull it like this. Okay. So again, you're going to hold here 30, 60 seconds, taking some nice deep breaths in, exhaling, relaxing. You can pull it like gently closer to you every single time. And then obviously we're going to do both sides, right and left, because we're symmetrical like that. Okay. So that was a lot of talking at you with all those exercises. I mean, I'm quickly going through them, but like I said before, I will send you guys all the stretches just so you have them. And they have the detailed instructions with all of them as well. And also, of course, anybody can feel free to reach out to me if something didn't make sense and I can kind of elaborate a little bit more on it. But yeah, those amazing job working through those. Remember, rebuilding strength postpartum it's a marathon. It's not about a race, okay? So it's about consistency, patience, giving your body the time to properly heal, giving it some love, some care, okay? So obviously core exercises are a key part of recovery, but they're just one part of the puzzle too, right? Healing kind of goes beyond movement. It's about also how you care for yourself every single day. From the way you rest to how you nourish, managing stress, all of these different things. Self-care basically plays a big role into your postpartum recovery. So I want to just kind of shift gears and talk about some simple but realistic kind of self-care tips that can help you feel stronger, feel more energized, and just support you through, this phase of motherhood right now. So kind of like I said, the postpartum period isn't just about healing physically. It's also about finding ways to kind of nurture you, be the best version of you, not just for your baby, but, just for yourself as well. So we're going to kind of talk about some different self-care kind of strategies here too. I'm sure many of you feel like there definitely are not enough hours in the day to take care of yourself. Or your baby. Like, it's one or the other a little bit. But these things, again, like I said about the exercises, it's just small little things every single day. It's not meant to be hours on hours of you doing self-care, but small intentional things just will go a long way for you. So the first one, and well, they're all important, but this is a big one, is rest and replenishment. So I know telling a new mom to get more sleep might sound like a joke, and everyone's always saying to sleep when the baby sleeps, and that's not always possible. But quality matters just as much as quantity, right? When you sleep, your body's repairing, it's balancing hormones, it's reducing inflammation, it's helping you heal, okay? So trying to maximize quality of rest and how much rest you get is going to be helpful, right? So yes, in the beginning, sleep when the baby sleeps. Even if it's a 20-minute nap, this can help you, right? If you can't sleep when the baby sleeps, it's not the end of the world, right? But it'll help you in the long run if you can. Um, if you feel like sleep is like you're uncomfortable, you're stiff, trying to shift to better position. So side lying, pillow between the legs, something like that. And again, if you feel like it's not possible, it's not working, reaching out for help with your partner, family, friends, anybody that can just help you get a few uninterrupted hours of sleep will obviously make a world of a difference, okay? Um, Also, your body obviously just went through one of the most physically demanding experiences of labor. So healing with food is also going to be really important, okay? So focusing things on like protein, this is all going to help with like tissue repair, hormone balance, healthy fats to support your brain and function, hormone production, fiber, again, really big thing, and then hydration, right? One of my simplest tips is just to have snacks like ready, small little things, whether that's, nuts, some boiled eggs, like things ready for a smoothie, like quick meals are going to help, but like these things that are just going to be easy for you in the beginning is going to go a long way. Okay. Now the second one, obviously gentle movements. Now we just talked all about like all these core exercises, these movements, but again, small movements, daily movements is going to really help in the beginning. Like I kind of said before, it's not about bouncing back, it's about rebuilding strength safely, okay? So starting off with some diaphragm, some abdominal breathing like we talked about, okay? Just really reconnecting yourself. Starting to get some of these gentle movements in with the pelvic tilts, the glute bridges, like all these small things. Getting some walking in. Being mindful, avoiding to high impact exercise too soon. Giving your body time. Let it rest, let it heal, okay? I will say when it comes to exercise, when it comes to the movements too, obviously you want to follow whatever your healthcare provider is saying. If they're telling you too soon to do X, Y, Z, if they're giving you a plan of like when you can start doing this, like obviously like you want to listen to them. Don't just jump into doing a bunch of things. And just because I told you these exercises again, like make sure that things are safe for you because everybody's body is different, everybody's pregnancy is different, everybody's postpartum recovery is going to be a little bit different too. Okay. Another self-care tip is that support system. So it's okay to admit if you're feeling overwhelmed or you're struggling. This does have nothing to do with whether you're a good mom or not. It just means you're human, right? Lean on your partner, lean on your family, lean on your friends, whoever's around. It takes a village, right? So lean on those people. One thing you do is kind of like create a schedule where people come by, whether they're helping with meals or chores or just being a person there. Scheduling these things, even though it can feel overwhelming, again, will be helpful for you, okay? Then setting boundaries is another big thing. So the next time someone kind of offers you advice about how to parent or asks you to do something overwhelming, remember that magic word of no. Because sometimes protecting your mental health means saying no without guilt, okay? So you're doing a lot, there's a lot going on, and you are allowed to say no and not feel guilty for that. I will be there to attest that for you and fight that for you, okay? And then my last little tip is just like creating a toolkit, okay? So whether that's a literal physical toolkit that's by the bed, in the nursery, but whatever's close to you, or it's more of a metaphorical toolkit. Ideas for that could be, a fun water bottle to stay hydrated, some quick and healthy snacks that you can grab between feedings or sleeping, your favorite book, relaxing playlist, something like that, a list of trusted people, whether that's friends or professionals, things like that you can call for support, okay? And then things just like, comfy outfit, whether that's PJ, something that's gonna, help you feel good again too. Okay. And then kind of the last little thing I just want to chat with you all about, a little kind of bonus thing, is just something that you're going to be doing all the time, which is lifting, carrying, and breastfeeding. Okay. These are a lot of daily movements that you're gonna, they might feel small and you're doing them all the time, but if done incorrectly, it can definitely wreak some havoc on your back, your core, your pelvic floor. But don't worry, I've got some, fun little tips. I've got your back with some tips to help you, okay? So the first thing is just like lifting the baby the right way. I'm sure many of you probably heard the phrase of like lift with your legs, not your back. But for you right now, it's going to be lift with those legs and engage your core. Okay. So if you're standing next to your baby, how do I lift my baby properly and safely? Okay. The first thing is to get as close to them as you can. Whether it's the baby, the car seat, the crib, the floor, whatever it is, you're going to get as close as you can to them. Next, you're going to try to lower yourself, whether that's a squat, a lunge, something that's going to like keep your back neutral, flat. You're not like hunching awkwardly forward to them. It's keeping your body in line. Then when you go to lift them, you're going to, again, think about engaging your core. Think about a light Kegel like we just talked about, or like pulling that belly button into your spine. And when you go to lift, you're going to push through your legs to stand up, again, keeping your baby as close to you as possible. That's going to be the biggest thing. It's a lot harder to lift something when it's farther away from you, and it's going to put a lot more strain onto your back when you do that, okay? And then another thing, obviously, is that if you're twisting or like pulling like this, again, that's going to be really hard on your back, upper back, lower back, everything. Okay. So as close as you can, right in front of you, lifting, pushing through engage that core and pushing through those legs. If it's a car seat, a fun little tip is this, like a lot of people like grab the handle and try to like swing it out, but instead you can try like the hook and hug method. So when you grab in the top, instead of grabbing it with your hand, you basically like slide your arm through, kind of resting your like forearm onto the seat and then using both hands to lift and keeping, again, that car seat close to your body as you do it. This one might make more sense just when you're actually like in the process of doing it. You'll see that it's easier to kind of push it in towards you. Okay. So that's lifting, first one. And then carrying, again, trying to carry the baby without wrecking your spine. You're definitely gonna be holding your baby for hours a day. So let's make it sure it's not causing you a bunch of pain. Okay. The biggest things are going to be switching sides and switching them frequently, okay? So you don't want to carry only on one side. That's going to cause a lot of muscle imbalances. One side's going to get really tight, really like overworked. So you want to try to think about switching as much as you can. We always say as chiropractors, a moving posture is a good posture. So if the more constantly you're switching, the better it's going to be. You can use a really supportive carrier, obviously. So again, a good baby carrier will distribute the weight evenly on both sides of your body, and across your shoulders and your hips. So again, putting less strain onto these areas. Keeping the baby again close to your center will keep it from straining your back. Every time you're holding them, so trying to hold them out here, hold them in closer. You'll also notice that's just easier on your arms and your shoulders in general. And then lastly, engaging your core when you're holding the baby. Again, trying to think about gently hugging your belly button in when you're holding them. A tip to avoid that dreaded like hip hop or the classic like mom hip stance. When you shift all your weight to one side and rest the baby on your hip, you're gonna over time kind of weaken the other side of your body and like tighten that one. So as much as you can, try to avoid that, or again, switch sides as more frequently if that feels like the most comfortable thing. Okay, and then breastfeeding. So again, you're feeding your baby. Obviously, this is supposed to be a bonding experience, not a recipe for the hunchback posture, but that is what ends up happening. So some best positions for breastfeeding. Number one, sitting into a supportive chair. So a chair with a good back support, one you can lean into and it's holding you upright. Honestly, a couch is going to be no support and probably bad news for your spine. But if you have a chair that's got a good backrest, good lumbar support, something like that, it's going to help you. Bringing the baby to you, so using pillows, using that nursing pillow, something to raise the baby up so that they're at their breast height rather than you leaning forward to hunch towards them. Another thing is to keep your feet flat on the floor. So again, this just helps kind of better promote posture and core engagement if you're kind of pressed into the floor and holding them. And then lastly, relaxing your shoulders, okay? So dropping them away from your ears. We don't need to be up here creating all this tension, just really relaxing into it. And then obviously switching sides, like I kind of mentioned again before. Same thing with breastfeeding. Try not to only rely on one side. Try your best to alternate back and forth. Again, sometimes easier said than done, but will go a long way. The biggest thing is to really avoid the leaning or the twisting. So trying to bring them as much to you rather than you to them, if that makes sense. Okay. And then some other little things. I mean, obviously, pushing a stroller is going to be another thing that's a big thing. So when you're pushing your stroller, just trying to keep those wrists neutral, your shoulders relaxed, walking upright again instead of leaning over, hunching towards that. Getting the baby out of the car seat again, instead of bending at the waist and twisting to get into the car in the awkward position that you probably all do. Step into the car almost into a squat and lift the baby towards you rather than to the side and twisting, if that makes sense. So you're basically getting like right in front of them into the car, squatting, grabbing, pulling them close, and then getting out. Okay, that was a lot of talking at you guys. Hopefully we covered a lot of valuable information, some exercises, and hopefully that kind of all made sense to you guys. We can take some time now to talk about some questions if anybody has anything, or if you want to bring up anything else. I will say, obviously, no questions too small, too personal, whatever you feel like it come to mind. Before we do, there's also like I'll kind of just talk through like a couple questions that usually come up when I'm talking with some postpartum women. So the first one is just like, how long is this all going to take? And that's honestly the number one question. And the honest answer is just that it's so dependent. Everyone's recovery, everyone's timeline is going to be different. So there's many factors, things like what kind of delivery you had, how you had it, whether you've experienced diastasis recti, whether you're consistent with your core exercises, like all of these things are going to play a big role. So I would say on average with like regular effort, most women will see improvements within like that 3 to 6 months. And like a full recovery might take a year or more. But again, that's an average. Everybody's going to look different. Everybody's recovery and journey is going to be different. The biggest thing is just like patience, consistency are going to be key here, and giving yourself a bit of grace too. That's kind of that one. And then another common one I get is like we kind of talked about before is like, do I have to do these exercises every single day? And it's like, no. The good news is it doesn't need to be every single day. It doesn't need to be hours every day. Even 10 minutes of just like focused breathing, core engagement, some stretching just makes a difference over time. And it's almost more about building these habits so that you're going to incorporate these into your daily routine. So when you're learning to engage your core, you're more likely to do it when you're feeding, when you're changing a diaper, when you're like watching TV, you know what I mean? You're just gonna like naturally do these things a little bit more. And then kind of the final question that a lot of people ask me is like, will my pelvic floor ever feel normal again? And again, it's a great question. And the answer is like with the right care, yes. Your pelvic floor is incredibly adaptable. And obviously going through labor, you'll see how much it can adapt to that and it can adapt back. So doing a lot of these exercises, the breathing, the pelvic floor, stuff like that, pairing that with physio, pairing that with chiro, can all work wonders. Obviously, if you're dealing with like specific symptoms, certain things, obviously don't hesitate to reach out for specialized care. Again, whoever that might be. If you have any questions, like I said, you can always reach out to me. I can kind of guide you where it might be better suited, but those are kind of that, okay? Now I'll stop talking for a second. If anyone has any questions, you want to unmute, or if you want to shoot something in the chat, let me know. Oh, there was one. How long after giving birth do I need to wait to see a chiropractor? So this is definitely person dependent. Again, now if you like, I've seen people that are like days after giving birth, like some people like wait a little bit longer. There's not really like the right or wrong time. It's kind of more up to you. If you are someone that's obviously had a C-section, there's just like limitations on certain things we would do. That's not to say we still can't treat you and help you in those first little bit, but you have a little bit more of a longer recovery. We're not doing a ton of, nothing twisting, nothing crazy onto your like lower back into your pelvis. But we can still help with some of the other things and talk about that. If you had a vaginal birth and it was pretty normal, not a lot of interventions, not a lot of extra things, then you could literally probably come days after and we could start working on stuff, right? But again, it's a lot of in the beginning is about like education, talking about what's going to happen, talking about some of these exercises, some of these kind of habits that we're going to build. Okay. Any other questions, anybody? Mm-mm-mm-mm. I heard wearing a belly band postpartum can unintentionally cause downward pressure and can affect your pelvic floor muscle healing. Is that true? So yes, if you don't need to have a belly band, I would say like the abdominal bracing in a belly band is very much like a band-aid of help most of the time. And it really, you only need it if you have like a very severe like diastasis recti, but severe separation, right? Where if you really just like need help to hold it into place and heal it, and I don't think you would be wanting to be wearing this like all of the time kind of thing, okay? Like it would be very specific for like what things you were doing, more again in the beginning and like kind of tapering off, but not everyone should be wearing one. Not everyone should be doing it for everything because yeah, it's gonna again like it could put a lot of pressure onto there. And if you have something going on, like you have a bit of those pelvic organ prolapse, that's gonna put a lot of pressure into there and keep kind of pushing it down too. So it's very person dependent. I think that was the best way to answer that question. And again, that'd be something to like reach out to a physio, reach out to a chiro, your OBGYN, your midwife, whatever it is, and see if like that's something that you need kind of thing. I think that first, like I would personally put like a patient through some of these exercises, some of these stretching first before jumping to the band, unless it was like a super, super severe separation. Hopefully that makes sense and answers that question. Another question on here just says, do you also work with babies? And yes, I mean, obviously you guys will all know that childbirth is quite the experience for you, but it's also quite the experience on the baby, right? There's a lot that happens coming out through the birth canal, and a lot of things can happen in the beginning. So I do see babies as well, and kind of help them with some of that, some of those impacts again of childbirth that happens onto them. But that could be a whole other workshop topic. Okay, any other questions though? Hopefully that all made sense so far. Okay, well, obviously we've covered a lot of stuff today. We talked about how your body changes during pregnancy, during postpartum, again, how to kind of reconnect with some of these core exercises, practical strategies for managing things like back pain, pelvic instability. And that was a lot to went through. So, and thank you again for being here. Obviously, there was a lot that we talked about. So if you guys have any questions, you need some more guidance, like honestly, do not hesitate to reach out to me. I kind of put my Instagram on here, my email on here. I know I emailed most of you guys the links, so if feel free to send me an email on there. And then, yeah, we can go from there. And also, if you guys want anybody or know anybody that wants this recording, you guys can also shoot me a message or an email and I can send the recording to you guys if you have anybody else that wants to know anything about it. But then, other than that, thank you guys all for attending. And yeah, I hope you guys all have a great weekend. Yeah, awesome. Okay, I will stop sharing my screen and thank you again, guys.